Hi, my name is Dr. Laura Hudson. I am a fellowship-trained breast surgeon here in Concord, North Carolina with Paragon Surgical Specialists. The National Comprehensive Cancer Network, or the NCCN, which is the group of guidelines that we follow, recommends that women start their screening mammograms at age 40 and undergo yearly screening mammograms. There have been some different recommendations from different groups over the years, but we tend to follow the cancer guidelines. Now, women who have very dense breast tissue may be recommended for additional imaging in combination with their mammogram, but that's something to discuss with your primary care doctor or even a breast specialist. Breast density has become a very hot topic, and I want to just explain what breast density means. So when you're looking at a mammogram, you're seeing an image in black and white of the breast. The white of the mammogram is actually breast tissue, which is what makes milk when women lactate. And the darker part of the mammogram is fatty tissue. And so the more white in a mammogram, the more breast tissue and the denser the breasts appear. Now, you can imagine if you're trying to look through a lot of dense tissue in a mammogram, that it can be more challenging and present more issues with finding small masses. Mammograms have gotten a lot better with 3D mammography in finding those small masses, but that's why dense breasts have become such an interesting topic for women. Now, many states require that the mammographers notify women of their breast density and that they may be good candidates for additional breast imaging on top of the yearly mammograms. "3D mammography essentially means that the radiologist is able to look at your breasts in many different views. When you get your mammogram, you'll notice that the machine is sort of moving over your breasts and essentially taking multiple different pictures of the breast tissue. And that's why it's a 3D picture. So it's able to see much better through dense tissue than the former 2D mammograms that used to be standard. Now 3D mammography should be standard of care, and it should be what every woman is getting. More and more women have been asking me whether mammograms are safe from a radiation exposure perspective, and I always tell them, yes, hands down. So the amount of radiation from a 3D mammogram for both breasts is about the same amount of radiation that we get from just exposure to the environment over about a 2-month period. It also is quantified as about the amount of radiation that you get from flying from New York City to Athens, Greece. I don't know if a lot of us are doing that flight frequently, but it's just kind of a good way of looking at it, that it's not an overly large amount of radiation. And we typically say that the benefits of mammograms and yearly screening far outweigh the risk of radiation. So after a screening mammogram, which is done when you have no breast complaints, you're just going in for your routine annual screen, about 10% of women will be called back for what we call diagnostic mammogram. And that is to look at a spot in the breast that was seen on a screen that needs just more investigation. So if you do get called back, it's important to just try not to panic and just know that they're getting more information by doing additional mammogram and potentially an ultrasound. If you get called back, they'll try to schedule that as soon as possible, and the results of your diagnostic imaging will be given to you that day before you leave the breast center.